This event was hosted by the Physical Health Psychology Service, and the reason why we hosted it was because we knew that there was a problem in the number of referrals that we were receiving from people from the Stoke-on-Trent and North Staffordshire region seeking support for their physical health psychological needs. And we recognised that we weren't actually reaching the numbers of people that could benefit from our service, and in particular we were only receiving about 2% of our referrals from people who were from the local community and your global majority or your ethnic minority groups, and that was problem and concerning for us, because in some of the catchment areas that we cover the population is as high as 43%. And I think that an event like this is really highlighted to us about all the different partners that we can work with in order to make our services more inclusive for everyone.
Today is kind of a bit of a twofold. First main objective is to try and break down the barriers to people accessing services. So we've noticed in our service that we've got a really small percentage of referrals coming from people from global majority groups. Bear in mind, especially because we're based in Shelton, which is obviously quite a diverse area, it's quite frustrating to see that these people aren't coming to us for help.
I've come to today's event to support other services who are working in mental health support, that's psychological assistance for communities and vulnerable people. In terms of who I am and what our charity does, we support vulnerable communities to improve their lives in all aspects of living in our city.
I think I was actually quite surprised by the number of people that actually turned up to the event. It kind of got me thinking that actually there's a lot of people out there trying to, do the sort of work that I'm doing as well, in terms of, just trying to understand the barriers that might be around for people in terms of accessing services. So I think it's really helpful to, know that that's going on and that's in place. So then I don't have to feel like I have to reinvent the wheel, and I can maybe meet other people and see what they're doing and just think.
Yeah, I feel the event's gone really well. It's been really interesting to speak with people. I feel there's been lots of really good discussion around different issues as well, and definitely got some bits to take away from it, I think, as well.
My name is Valerie Ann Pruitt, and I am part of the Asylum Seekers and Refugee team at Shelton. I'm part of MPFT, so I'm a sister to combine. The topic itself about physical health, what we have found in our client group is that many of them do not know how the NHS works. So physical health, and then they come from countries where health was not a priority. So it's just about understanding how best we could serve and meet people's needs, and how we could encourage them to engage with services. So today was fantastic.
I found the event really inspiring. It's been amazing to hear from professionals within the service providers and hear their perspectives. And it's been really encouraging to hear. I think it's pretty much a shared message across all the speakers of a willingness to engage with all communities, and a clear identification of the gaps in services, which is not something you always see, not with complete sincerity in any case.
I think a takeaway for me is probably something that I was already kind of moving towards, but I'm glad it's been mentioned a lot from other discussions. So this idea of having more presence and involvement with kind of community and voluntary services. I think we can work in isolation sometime and expect people to come to us. So I think actually something I want to think about, how we can kind of move towards some of the other services and kind of make better connections and links there.
I think this is a great event, and I think that the more collaboration that we have between trusts, that we have between communities, that we have between practitioners, I think that's vital for us being able to reach and to be able to enhance the care experience of our clients.
I think for me it's been the friendliness of Stoke-on-Trent and North Staffordshire. like the energy in the professionals, the passion within the council, the need and want within sort of multi-agencies to work together. And I think I wasn't aware of that energy until I actually embarked on this project where we as a team wanted to go out and learn what was happening outside in Stoke-on-Trent. It's such a vibrant city, such a positive energy, and so many professionals that want to make a difference. The thing that I think was missing was that we're just not connected very well. So there's lots of different pockets of funding that people of all kinds of backgrounds can access. But if we don't know that each other exists, a lot of that money is not being utilised in the most effective way. So this is our offer from the team to make sure that we are known to the council, to local NHS and voluntary sector organisations. We're not shirking our responsibilities. We want to help the people that meet our criteria.